Hi, my name is Alex, and today I'm going to be presenting my sports injury webinar. The injury that I have decided to do my presentation on is the dislocated shoulder. Firstly, we are going to be talking about the bones affected by this injury. The shoulder joint is made up of three bones: the scapula, the clavicle, and your humerus. The scapula is known as your shoulder blade, the clavicle is known as the collarbone, and the humerus is known as the upper arm bone. Two joints in the shoulder allow it to move: the acromioclavicular joint, where the highest point of the scapula meets the clavicle, and the glenohumeral joint. A dislocated shoulder is an injury in which your upper arm bone pops out of the cup-shaped socket that's part of your shoulder blade. This upper arm bone is known as the humerus. Fractures commonly involve the clavicle, which is the collarbone, the proximal humerus, the top of the upper arm bone, and the scapula, your shoulder blade. Dislocations occur when the bones on opposite sides of the joint do not line up. Dislocations can involve any of the three different joints. Now we are going to be talking about the muscles, ligaments, and tendons affected by this injury. In most cases, the labrum, a layer of cartilage that lines the glenoid bone and serves as the attachment site for the ligaments, will be torn. Less commonly, the ligaments may fail from the humeral or ball side of the joint. This has been termed a HAGL, a humeral avulsion of glenohumeral ligament lesion. The dislocation can tear ligaments or tendons or damage nerves. The muscles may also have spasms from the disruption, which can make the injury more painful. Now we are going to be talking about how this injury is caused. So the shoulder is a very mobile joint and more vulnerable to dislocation than other joints. Muscles, ligaments, and the bone anatomy of the shoulder all work together to maintain shoulder stability and prevent dislocation. Dislocation can occur when any of these structures are injured or altered in any way. Tears or ruptures of the rotator cuff are the most common injuries that lead to shoulder dislocation. Fractures of the humerus and damage to any of the nerves, for example, the axillary brachial plexus supplying the rotator cuff, can also result in shoulder dislocation. A fall on an outstretched hand can cause an anterior dislocation, which is one of the three shoulder dislocations. And also violent, uncoordinated muscle contraction during a grand mal seizure can also cause shoulder dislocation. Forceful motions that cause soft tissue structures to tear or rupture can lead to dislocation. Forceful abduction, external rotation, and extension are the most common load resulting in shoulder dislocation. The joint capsule may be lifted off the bone and the head of the humerus gets lodged between the capsule and the bone. Once the shoulder has been dislocated the first time, there is a high probability, 90%, of a second shoulder dislocation. The highest incidence of reoccurrence is in young people. Participants who participate in contact sport activities increase the risk of re-injury or injury just in general. Now we are going to be talking about the complications and rare cases of the injury. The first and most obvious complication with the shoulder injury is possible damage to surrounding bones and muscles as a result of the trauma that caused the dislocation. Nerve damage is also a very real possibility, and it usually comes in the form of an injured circumflex axillary nerve. The primary symptom of this type of damage is numbness on the outside of the upper arm. Untreated nerve damage to the circumflex axillary nerve can result in weakness of the deltoid muscle and restricted shoulder movement. For older patients or patients who smoke, a rotator cuff injury or tear may accompany a shoulder dislocation. This often requires a follow-up visits, tests, and physical therapy to gauge the type and extent of the shoulder damage. The rarest and most serious complications can include the tearing of the axillary artery, negative drug interactions, and associated muscle tears that need surgery. In rare cases, surgery is needed to repair the damage. Now we are going to be talking about medical treatment and healing. When a shoulder dislocation is suspected, immobilization and ice are critical. Additionally, a patient should not be given anything to eat or drink in case sedation is required during medical treatment. Then, generally, scapular manipulation or the external rotation method is used by the doctor in order to put the shoulder back in the correct place. Even though I said this prior to this type of treatment, in most cases, the doctors will have to undergo x-rays so that they can see the internal structure of the shoulder and what type of dislocation it could be and what type of treatment is needed. Now we're going to be talking about the scapular manipulation and the external rotation, the specific process of it. So scapular manipulation is done by rotating the shoulder blade, dislodging the humeral head, and allowing the shoulder to snap back into place. It's usually done with two medical professions. If you look on the right, you can see a photo of how it basically looks. External rotation entails the healthcare professional using a gradual external rotation of the shoulder to prompt the shoulder to spontaneously relocate. It can be accompanied by moderate to severe muscle spasms. Now we're going to be talking about the recovery and physiotherapy process. Once your shoulder is back in place after receiving medical treatment, your doctor may use a special splint or sling for a few days, but all the way up to 3 weeks, depending on how severe your shoulder injury is. And also for recovery time, it also depends based on the severity of the injury, but it could vary from 12 to 16 weeks. After any period of immobilization, muscles weaken and become less flexible. So doctors recommend physical therapy to rebuild the muscle, improve stability in the shoulder, and prevent further injury. Doctors recommend 4 to 6 weeks of physiotherapy as part of a treatment plan for a shoulder dislocation. But again, the recovery time, the amount of physiotherapy needed depends on the severity of the injury, the person's age, overall health, and whatnot. Physical therapist will show you some simple exercises designed to stretch and strengthen the muscles surrounding the shoulder, including the muscles in your arm and upper back. If these muscles are weak, the joint itself bears more weight during movement. Developing strong muscles creates an internal brace for the shoulder joint. Physical therapy can also increase flexibility and restore range of motion. Some very good exercises to perform when you have to recover from a shoulder injury is isometric shoulder abduction, isometric shoulder external rotation, shoulder blade squeeze, wall push-ups, shoulder rotation/rolls, lateral raises, and shoulder presses. Obviously, some of you might not get a good understanding of how the exercises look by me just explaining them. So if you look on the right, there is a little bit of a diagram and description of how the exercises should be performed or how they look. Yeah, so that is all my information for this presentation. As you can see, there are 5 different APA references that I used to complete my report. And yeah, that's about it. Thank you for listening, and I hope my presentation was very informative and you were able to learn more about a dislocated shoulder. Thank you.